Nicole.
Shayna.
How are you?
Nice.
I'm Nicole. How are you?
Shayna, nice to meet you. Thank you both for coming. Today, Nurse Nicole and I are going to teach you about your medications and how to use them. I know your doctor already discussed your diagnosis of HIV with you. Do you have any questions?
I do. I don't understand how she got it.
HIV is usually sexually transmitted through blood, semen, and vaginal secretions.
I'm very upset this happened. How could this happen?
Tell us more about what is upsetting you.
I feel like this is just another thing I have to worry about with her. She's my daughter. I want her to be healthy and safe.
We understand that you want her to be safe and healthy at all times, and we are here for you both to help you with this transition.
Is this going to totally change my life?
There will be some adjustments to your life. However, the medications that were prescribed to treat you will minimize the effects of HIV, improve your quality of life, and suppress viral replication so that you can still go on with your daily life.
You say treatments. How many treatments does my daughter have to be on and why?
3 HIV medications in combination with other antiviral medications are prescribed for Janet to reduce medication resistance, adverse effects, and dosages. It's called HART, or Highly Active Antiretroviral Therapy. Although aggressive, it reduces the amount of the virus.
Oh my goodness, so all 3 treatments will decrease the virus and deter adverse effects. Can you please tell me about them?
Yes, of course. Shayna and I are going to go through each one with you. We provided the prescription information for you both, so you can read along and write down anything that we say that isn't there or may be confusing.
The first medication is zidovudine. Janet will be taking 200 milligrams by mouth every 8 hours.
Okay, so Jenna has to take this medication 3 times a day. What exactly does medication do?
Zidovudine inhibits viral enzyme reverse transcriptase and thymidine kinase. A handful, I know. These enzymes are necessary for viral HIV replication. This medication will stop that from happening and is the first line of antivirals that will treat HIV infection.
So this medicine will stop the HIV from duplicating. Are there medications to avoid while taking this?
Methadone valproic acid may increase concentration of this medication and cause adverse effects. So if you are on any of these medications, we would reduce the dosage and monitor you for medication toxicity. We would also have to monitor you and adjust dosage levels because ritonavir, which is the second medication you'll be taking, can reduce zidovudine levels.
Okay, well she's not on the first 3 of those medications, but because she'll be taking ritonavir, you will monitor because this medication can reduce by it. Are there any complications to this medication?
Unfortunately, yes, but we would monitor Janet for any complications going forward. A few complications are anemia, thrombocytopenia, lactic acidosis, seizures, congestive heart failure, and Steve Johnson syndrome, which is a reddish, purplish rash of the skin and has flu-like symptoms. If any adverse effects do occur, we would discontinue the medications.
I will definitely let you know if any of these do occur. Do I have to take this medicine on an empty stomach?
No, it should be taken with food. The medication does cause nausea, vomiting, and diarrhea.
Okay, so I will make sure she takes it with breakfast, lunch, and dinner so it doesn't upset her stomach. Is this drug toxic? We don't take medications in our house.
This medication is used very cautiously with those who have liver disease or bone marrow suppression.
This medication is also contraindicated with patients with medication hypersensitivity.
Okay, Jana does not have liver or bone marrow disease or suppression, and she doesn't have medication sensitivity. What about the others?
Well, the next medication that is prescribed here is ritonavir, which is a protease inhibitor. Never crush or break the tablet, but swallow it whole.
Okay, I will make sure I never crush it. How many should I take a day? Should I eat with this one too?
This drug is based upon your weight, liver function, medical condition, and other medications. You would take 600 milligrams twice daily with a meal because this does cause gastrointestinal effects as well. Also, you can't drink grapefruit juice with this medication, and because one of the complications of this medicine is osteoporosis, you should make sure to include calcium and vitamin D in your diet.
I will make sure she gets calcium and vitamin D, and that she takes this one with breakfast and dinner. It says here that this drug interferes with an enzyme called protease, which is used by HIV-infected cells to make new viruses. Since ritonavir inhibits or reduces the activity of this enzyme, this drug causes HIV-infected cells to produce fewer viruses. Well, that's very good.
Yes, it does. We also have to confirm that Janet does not have any allergies to this drug because any allergies to the drug or the inactive ingredients to the drug may cause an allergic reaction. If she were to have diabetes, this drug may increase their blood sugar. Some medications that interact with this drug are cabiostat, disulfiram, or thilistat. Also, ritonavir may decrease the effectiveness of hormonal birth control.
That's very good to know. I don't usually have allergies to medicines, but I'm glad I'll be tested before I start it. I'm not diabetic and I don't take those other medications, but I do take birth control. I will make sure from now on that I use other forms of contraception like condoms on top of my birth control. It says here also that the capsules should be stored at room temperature below 25 degrees Celsius or 77 degrees Fahrenheit if used within a month, but for a longer period of time to keep refrigerated.
Yes, please keep that in mind. It's very important. I also want you to be aware that this drug is toxic to the liver. So if you have decreased appetite, fever, nausea, change in color of your stool, or jaundice to the skin, please let us know immediately.
Yes, I see here it says, check with your doctor right away if you or your child had pain or tenderness in the upper stomach, pale stools, dark urine, loss of appetite, nausea, unusual tiredness or weakness, or yellow eyes or skin. These could be symptoms of a serious liver problem. I will definitely keep my eyes on her.
Good. It's also important that you both know that there are adverse side effects as well to this medication, including hepatitis and risk of increased bleeding with patients with hemophilia. Then we would stop the drug. However, please keep in mind it is very important to continue taking this medication and other HIV medications exactly as prescribed by your doctor. Do not take more or less of this drug than prescribed or stop taking it or other HIV medicines, even for a short time unless directed to do so by your doctor. Skipping or changing your dose without approval from your doctor may cause the amount of virus to increase, make the infection more difficult to treat, or worsen the side effects.
Okay, I'll make sure I get a pill box so I don't miss any doses. It also says to avoid many medications like alphazocin, amiodarone, and cisapride. I'm not on any of these medications here, so that's good.
The next medication is enfuvirtide. It says given subcutaneously. What does that mean?
A subcutaneous administration means that it's injected under your skin. You must rotate your injection sites and monitor your skin for any redness or swelling. The areas you can inject are your abdomen, back or side of the upper arm, front thigh, upper gluteus muscle, or both scapula. We will show you how to do this later on as many times as you need in the examination room and have you demonstrate it as well so you feel comfortable doing it on your own.
Okay, good. I will make sure I rotate my injection sites and write them down so I remember. It also says the dosage is 90 milligrams, which is 1 milliliter twice a day, reconstituted. What does that mean?
The medication has to be mixed, so you'll be given a powder, which is 108 milligrams vial of enfuvirtide, and it has to be reconstituted with 1.1 milliliters of sterile water, which delivers 90 milligrams of medication, reconstituted. When Shayna and I show you how to administer the subcutaneous injection, we will also show you how to correctly mix the medication.
Okay, now I understand. So I mix the vial with sterile water and it is reconstituted to become 90 milligrams of medication. So that's what it means when it says stored at 77 degrees Fahrenheit, but if mixed, keep in the refrigerator and to bring to room temperature before injection. I also take this every 12 hours.
That's right, you got it. And you can take it with or without food. And remember, we will show you as many times as you need how to mix and inject the subcutaneous injection.
And this is used to decrease and limit the spreading of HIV that other antivirals may be unresponsive to. I'm understanding better now why she needs to take 3 medications.
Yes, but this medication unfortunately has some complications too. We do need to assess breath sounds prior to the start because this medication does have complications with bacterial pneumonia. We will also monitor for signs of pneumonia throughout the course of therapy. Please be aware that if you have fever, cough, or shortness of breath, to contact us immediately.
Okay, so if I have cold-like symptoms, to let you know. It says here also that if I have fever, chills, rash, or hypotension, to discontinue and notify my provider as well.
That's correct. Also, this medication is contraindicated in patients who have medication sensitivity and who are breastfeeding. Just keep that in mind for the future. But it is also very important that you let us know if you do suspect that you are pregnant.
Okay, I will definitely contact you both if I suspect that I'm pregnant.
Also, you must take this medication as prescribed to minimize the development of resistance.
I will stay on top of her and make sure she's taking them all as prescribed.
Do you feel less worried since we've all talked?
Yes, I do. Thank you. I feel like this is something we can manage and we will do just that.
Good. We have a pamphlet for you both and a list of support groups if you're interested. Do you have any other questions or concerns? And remember, we are available at any time a question arises. Please don't hesitate to call.
No, I don't. Thank you. You both answered all of our questions and addressed our concerns. The diagnosis was very disturbing and upsetting, and you both made me feel a lot better about how to approach it going forward. I understand that there is no cure for HIV, but strict adherence to antiretroviral therapy can dramatically slow the disease progress, prevent secondary infections, complications, and prolong life. I understand that it is extremely important to take the prescribed medications and monitor myself routinely for any complications or adverse side effects. and I would definitely be interested in support groups and pamphlets. Thank you again.